Let me welcome everybody to this Zoom webinar on Policymaking 101, on learning how to make a difference within your Texas Medical Association and within the House of Delegates. Now, if we could go to the next slide, at the very early outset, I'm required to point out that for CME credit, these are our objectives for this program, is to explain policymaking best practices, including how to define what a resolution is, evaluate a resolution, being weak or strong, discuss what items are actually part of TMA's scope of work, and then discuss what happens once a resolution goes to the House, and then even once it emerges. You can earn one MA PRA Category 1 credit for participation, and we can talk to you about how to get that at the end. The Texas Medical Association is accredited by the ACCME and designates one category credit for this. So I think with that, we can go on to the disclosure, which is just that we are required to disclose any financial relationship which may have with commercial entities whose products or devices are herein, which there are none, to which we are aware, but no disclosures then at this point. Before I formally start my portion along with the Vice Speaker, let me turn it over to our HOD staff, Marty Francisco, who handles the House of Delegates issues before TMA, and she has a few announcements to make. So Marty, and then I should also mention Karen Kolar, who's behind the scenes here controlling the slides. So I appreciate both Marty and Karen for their hard work that went into this presentation and for their help tonight. As we appreciate it and will no doubt need it. But Marty, do you want to tell the folks some good words?
Hi, everyone. Thanks for joining tonight. Just a brief little intro. We're going to host some question and answer session at the end of this presentation. And if you do have a question, please do enter it into the Q&A icon down at the bottom of your screen. And I will read them aloud to the speakers after they give their presentation, and they will go over them and answer them to the best of their ability. Other than that, the chat function has been turned off. So if you do have any troubleshooting questions, you can enter that into the Q&A as well, and I can try and handle that behind the scenes. And that's all.
Very good. Well, thank you, Marty. Let's then formally begin. I'll introduce myself. My name is Brad Holland. I'm serving as your speaker of the TMA House of Delegates, and a pleasure to have you all with us tonight. We're going to, I think, have a conversational, informal discussion about how TMA makes policy, and then some recommendations about that. But joining me, as he mentioned, for a color commentary, and we appreciate his expertise in it all, is our Vice Speaker. John, do you want to introduce yourself?
How y'all doing? I'm John Flores. I'm the Vice Speaker of the TMA. It's my pleasure to join you tonight. I just want to say, typically, Vice Speakers are a little more eccentric and out in left field, but I want to assure you that's not the case this year, unlike last year. Brad?
Oh, thank you, John. He and I will be tag teaming it tonight as we go over this process of policy making. So let's get right into it. What happens when we talk about making policy within TMA? And I think this is a very good overview slide about how to take an idea, which if you start at the very center of the slide, that's the light bulb, the idea. And an idea can sort of evolve in two ways. Most commonly then, as we know, that can be introduced into the House in the form of a resolution. And you see the three common ways an entity can introduce a resolution, either from one of the sections, which we'll talk about, from an individual county medical society, from individual voting members, and then the different caucuses, which may or may not be a county medical society or an individual section. Other ways, though, that ideas can evolve within TMA are to become a report, either from the board, from one of the foundations, Alliance or TexPAC, from a council or committee itself, and then from a section itself can also issue a report. But both reports and resolutions then are fed to the House of Delegates as a body. And out of the House of Delegates, we can either pass something that becomes TMA policy, and that's the far left pathway there with policy established and giving TMA guidance based on that policy. We can pass something to the Board of Trustees for implementation, and that has to do with TMA programs and activities most commonly. We can pass something that would be how TMA handles legislation, and that would go to the Council on Legislation for lobbying the state legislature here in Texas. And that then ends up as beneficial state legislation and or regulations that our legislators vote on. Or last, it could be given to the Texas delegation to the AMA for any federal issues and regulations. John, do you want to mention anything?
Yeah, Brad, I think it's just so powerful to think that some idea that one of our members might have, say in Lubbock, Texas, they're discussing it with their colleagues or within their county medical society, maybe even their caucus, and they're able to bring that to our House and make substantial change in how things are done, not only in our House delegates and our TMA, but at the AMA and at the state level, maybe even the federal level.
That's right. Well, so as at the center of that then is the House of Delegates. If we go to the next slide, this is how TMA itself is organized in terms of governance. And the House of Delegates is the highest body within TMA for both policymaking as well as governance and passing issues related to bylaws, related to Constitution, and then all other underneath that. And under the House of Delegates, you have sort of the two bodies, the Board of Trustees, which also has underneath it the Interspecialty Society and Committee on Membership. And the board handles the workings of TMA and implementation of things that the House may pass, as well as issues that come up throughout the year that require our large organization, which is a nonprofit, a large budget nonprofit, one of the bigger state nonprofits. Board of Trustees handles those on a daily, weekly basis. The Board of Counselors over at the other side, along with the Physician Health and Wellness, is more the regulatory within TMA, handling internal policy, handling some matters of more of our judicial type of issues in terms of internal governance, deciding fairness, sometimes even sanctions against a person or complaints. That's handled by the Board of Counselors. And then you have your Texas delegation to the AMA, which is our liaison to federal issues at the AMA. And we have our sections, two of which were added fairly recently. So we have our International Medical Graduate section, Medical Student, Resident and Fellows, and Young Physician section, and the two newest sections of the Women's Physician section and the LGBTQ section. Those then are above all of the councils and committees. And here you see the, I believe it's 9 councils that we currently have within TMA: Council on Constitution and Bylaws, Healthcare Quality, Council on Health Promotion, Health Service Organization and Legislation. And then the ones we're usually all more familiar with: the Council on Medical Education, on Practice Management Services, Science and Public Health, and Socioeconomics. And the representative committees underneath those councils are then also listed there. Councils, we've added some councils and moved governance around a little bit here at this level. Committees are also somewhat in flux. We sunset committees. We've subtracted some, we've added some. So it always helps to be aware of this slide so that you know kind of where things stand. But this is how the House and all of its other parts of TMA come together. John?
I think it's wonderful that there's so many ways to get involved in TMA. If you see something that you want to get involved with and know more about, and you're not sure how to do it, I would start with your county exec. And if they're not sure how to do it, have them contact me or Brad or one of the other staffers.
That's right. So let's spend a moment just on the House of Delegates itself. And if we can go to the next slide, the House representation. So the way we determine representation within the House is that there is one delegate per 100 county medical society members, and then a delegate for each additional 100 members or fraction thereof. And then some counties are not incorporated within a county medical society charter and are classified at large members and also then receive delegates. And that gets us the bulk of the representation, but there's also voting ex officio members of the House. And that includes members of the Board of Trustees, which there are less than 20, but about that many, also considering past presidents. And as of a new policy passed recently, past speakers will also be ex officio members. There's 15 counselors who get ex officio voting status. Our AMA delegate and alternate delegates are ex officio members, as well as members of the Council on Legislation. All council chairs, section delegates, each section gets a delegate to put into the House, and specialty society delegates. And with that, we have a variable number of people seated, but hundreds of delegates, needless to say, over 400. Sometimes we make 500 delegates and then alternates in the House. to when we come together at TextNet as a full house, that is who is seated and who is credentialed. John, do you have anything on that?
Well, an ex officio member, that kind of always confuses me. It sounds like you're no longer a member, but what it means is you get a vote just for participating in one of these roles. And so if you're also a delegate, you don't need, and you're ex officio, you need to make sure somebody else takes your spot as a delegate. So your county medical society gets their full representation.
No, that's a good point. A lot of people may wear two hats within TMA, and there's no point in excluding anybody if you are having a voting status in one of these, and you can let another person take potentially the second wear in the voting spot. House members is within the next slide. I really think there's two main roles that each delegate has, and the first is to be the representative of your medical society and to sit in the House, listen, hear debate yourself, offer debate with you on your own comments, but to vote then the way you think your county medical society would want you to vote as their delegate. That's half of it. But the other half then is to report back, I think, what happens, because as we know, there are people that are connected with TMA, but many back in your home areas are not. And so it's just as much requisite on you to take the information back and trying to disseminate it, to tell people what has gone on, what have we passed, what the new policies are, what the debates, what the questions are, what the issues of the day are. So it's a two-way street. You, as a delegate, you need to participate in the House and represent your county and their views, but then you also need to take back what happened and try and disseminate that to your county. And here we just see some of the logos. I'm not quite sure how many now we have individual county medical societies, but obviously Texas is a big state, lots and lots of counties, and lots of diversity here within. John, yeah.
Well, no, I totally agree. It's a two-way street. Our job as delegates is to hear the concerns of our county medical society colleagues and bring those to the House of Delegates, whether in a resolution or through your testimony on an issue. That's our job. And the other half is telling us what happened. Why did you go to Austin or to Houston and spend 2 or 3 days, meeting? What did you do? So always take notes about things that you think your members are going to be important. So when you get back, you have something to share with them.
Well, and I'm notoriously dense on all things besides just sitting in front of the Zoom, but I do see that Marty has put in the chat 110 component county medical societies here in Texas. So good to see that number bigger than I remember. At least we're growing and getting more counties activated. Well, so that's a little bit about the House, but the bulk of tonight is about policymaking and resolutions, and that's what we call Resolution 101. So what is a resolution? Well, as we talked about, a resolution is an idea, and it originates in one of these ways, but let's say for now it originates with you. And so you have an idea. We give you full latitude in terms of both a title and then how to structure the resolution when it's introduced. And that's important even just to get going. Now, if you have a title that's 38 words, we're probably not going to refer to it by all 38. So you do have some leeway in terms of how your resolution is titled and how it's broken down into both whereases and resolves. But before you even get that far, you need to consider your action. Is your idea, does it fall within TMA's scope of work? Is it right for TMA to have a resolution that would be talking about realtors or cars or something that is not in the bounds of a medical association? It needs to be relevant to what TMA is doing. And does it really significantly change policy, or is it requesting some study so that policy can be changed? And anytime you write a resolution, and this happens probably every now and then, every other year or so, we get something that's written that's someone's very passionate and they say the TMA demands and really puts strong language in there. And while you may be passionate about that, we'd always use the language request and not make it a manifesto or a declaration of war. Resolutions are our policy, and there is a demeanor in them that is important. So you write it as a request and not as a demand. But to be as specific and be as realistic as you can, And there's always a lot of people to help you at this early stage when you're trying to come up with an idea to get it into resolution form. In fact, if you do submit a resolution, our TMA staff can at least modify it to put it in the correct sequence and verbiage that TMA uses. But so this is sort of very basics of how it's germinated and really quite helpful to remember. Even people that have written resolutions year after year after year, I think coming back to this idea whenever you do write one, these are the sort of things that need to be going through your head before you put pen to paper. John? Mm-hmm.
I think ultimately a good resolution is going to make a meaningful change in our policy and how we do things. And also the best resolution is going to make a change in how we deliver care and improve the livelihood of our colleagues and our patients. Now, those are high goals, so don't be daunted by that. Sometimes an idea starts very small, and as you address that and talk to your colleagues, it might build and be polished to really be sterling.
Well, it's hard to categorize what makes a good resolution, but I think in general, if we go to the next slide there, get back to our core on what TMA is here for and what our mission is. The best resolutions both help patients and physicians, and that's really what we're all here for. But they also potentially alter TMA policy in a way that is meaningful, or take a position that it's changing in a slightly helpful way, potentially a major way. But remember that this is a democratic process. It needs to be something that you think the majority of TMA members will support, because that by definition is how something passes. It's with majority support. We want, frankly, resolutions that are introduced to strengthen our organization, not to detract from it. It needs to be timely, so we aren't talking about things that happen way in the future, but we aren't talking about things that happened way in the past either. We have a limited amount of time to consider resolutions on any given TexMed Saturday morning, and so we want things that are relevant and timely and then of the correct subject. Now, as you know, politics has been interjected into almost everything, and there's plenty of ways Americans are divided. We really want things that build our organization and pull us together. And so we do try and ask people to stick to the science and practice of medicine and not to be detracting from our time. That's what TMA is about. And so I think both those points that we've talked about there, but then also when you introduce something, you want to show that it has not just your support as one delegate. You want to try and make it look like it's supported by the biggest contingent that will be willing to support it. And so while you can introduce it as an individual delegate, that's perfectly acceptable. Things have a better chance of passing if you are sponsored, if your resolution is sponsored then by your county medical society, by your section, I suppose say by your caucus or delegation. And so try and do your work ahead of time. And that all happens usually starting about now as people are getting close to winter conference and before resolutions are actually due, that you're writing these and passing them around and seeing if you can get people to sign on to say, yes, your county will support this resolution and be introduced by your county, be introduced by a section or by a delegation. So those are really what happens with the best resolutions.
For me, I think what gets lost when we start making these resolutions, then we have a great idea here and a great idea there, is the purview of the TMA. Is it within our ability to make that change? I think you got to keep that in mind, because there's some great ideas out there, but they're maybe not the right place is the TMA. And then also what you said about the politics, we make lives better for ourselves as physicians and our patients, and politics really shouldn't enter into that.
Well, so if we talk about some of the basics in terms of continuing on writing a resolution, you have to remember that a resolution is going to be considered in a parliamentary way, which for some people that's intimidating in and of itself, but we now use the American Institute of Parliamentarians Standard Code, AIPSC, and that's new within the past 4 years. But I think it's a little more user-friendly than purely Robert's Rules of Order. But it is a process and it's quite formal, and we adhere to that in the House. And so to take an idea if you have a resolve clause that does 5, 6, 7 different things, it's much better to break those out into each resolve clause, to multiple different resolve clauses, so that we can handle that from a parliamentary standard, as opposed to trying to change one resolve clause with multiple amendments or additions, subtractions, strikings. Making it as simple, straightforward, and each resolve clause sort of just one idea and one action item. That makes it much more parliamentary pure, makes it easier to handle and to process your resolution. And occasionally it can be broken up easier, so that you might get some of your resolves passed, but not all of them. But that may be more than what you would have got if you had it all together. So breaking each item in your idea as a new resolve helps us both parliamentarily, as well as may actually get it referred to the right people more appropriately, or past part of it and refer another part of it. That's happened before too. So, but try and make each resolve stand alone and be very specific, and not a hodgepodge of multiple things. Your resolution needs to say what action that you wish to take. So whereas you may be giving factual support, the resolves itself should just be purely the action. So you don't need to be justifying or putting the reasons for the action in the resolve part. The resolve should be purely the action. Have any specific? Yeah, go ahead.
I agree that the wording should be very clear and unambiguous. Now, over the last couple of decades being in organized medicine, I've read a lot of resolutions, and I love it when somebody just tells me exactly what they want to happen. This isn't where you want to bring out your writing skills and use flowery words. You want to be real specific, and when somebody reads that, they'll know, oh, I want him A and B and C need to happen with this resolution. And also when you're writing this, think about it, this is going to be policy. One of our TMA staffers is going to, probably Marty, she does a lot of this, is going to sit down and make that resolution into policy. So they need to know exactly what you mean. Otherwise, it might not come out like you want it to be. I think something else is that when you write policy, you need to realize this is going to be very broad. We want policy for, say, for instance, you want Blue Cross Blue Shield. You're going to say Blue Cross Blue Shield should pay physicians in North Texas $500 to see a new patient. Instead of saying that, be too specific, make it a little more broader, that maybe all third-party payers should reimburse physicians at rates that reflect their skills and training and the medical economics of running a practice. So we don't have to go back and change that policy when we decide that United Healthcare is doing the wrong thing. This would pertain to all third-party payers and all physicians. Hopefully you see what I'm trying to say there. Thanks.
Yeah, no, I think that's exactly right. So that your resolution is not tied to the here and now of 2022, but if it is policy, then it can go forward in perpetuity as our policy until it is changed otherwise. But and as you're talking about policy, looking at our TMA policy compendium, which is the entire list of all TMA policies, we call that the TMA policy compendium. And if you have specific wording that you want to add to that, then your resolution needs to reflect that. And if you have questions about this process, you can go to our handout, the TMA resolution process, at texmed.org/HOD. Let's expand on that in the next slide just a bit, because there really is quite a bit available at texmed.org under House of Delegates. And if you go on the left side there to House of Delegates, you can see a House of Delegates guide. You'll be able to see the policy compendium, the audit trail. There'll also be something about the election process. And after January, there will be the speaker's letter, which talks with specifics about the election process in 2023 as we approach TexMed 2023. And then the balloting procedure as well, given the individual rate. Now, one thing that is new for TMA a bit is that we wanted to make our policy completely available to all our members, but there were some reasons why we didn't want necessarily every single person to be able to look at all our policy, to be able to be misquoted, and frankly, to put it in line with many other nonprofits and other policymaking bodies, so that there is some value to it. We don't just give it away for free to the media or anybody else that may be searching. So this time now, you'll see on the right side, there's a little lock sign. and anything that has a lock sign it, like Find TMA Policy or Ethics Opinions, the Audit Trail, and further on the House of Delegates, you have to be logged in because that is behind a paywall. You have to be a member to see that. And that's new for TMA, but it makes us a little bit more secure operation, and also lets us handle a little bit if there is media out there or something that wants to quote a TMA policy, that we have to know what they're requesting and give it in a proper way. That's not a big deal. And if you ever have problems with your log on with your password, we're able to help with that pretty easily. I've always been impressed with the Knowledge Center, as well as if you email House staff, that we've been able to handle those pretty well. But that's quite a list on that right side of resources, where you can search current policies and see if what your resolution is changing is already policy. And I'll have to tell you, a significant portion of our resolution ideas, once you actually look to see, do we have policy on it, you'd be surprised. For the many years we've been doing this, there's not a whole lot of holes where we don't have at least some policy. There are some, but I will say a lot of ideas get stopped really at that stage when you realize that TMA already has relevant policy, and frankly, policy that if people knew, you'd be favorable towards. So make sure you search current policy before you try altering policy. Sometimes the ethics committee or the ethics opinions as issued by the Board of Counselors can be relevant to certain resolutions. And then anything that happened in 2022 or before, up to 10 years in the past, you can look up those items and see where they stand now, where they're moving through TMA. So things that were passed in 2022, some of them are still in council or committees. There'll be reports on those back. Everything that was reported to those committees from 2022 will be reported back to the House in 2023. And the audit trail tells you exactly what's happened with each resolution from the past, including the most recent year. John, you have anything on that slide?
No, I love the audit trail. I remember my second year in the TMA and House of Delegates, and I was sitting next to Jim Rohack, and he goes, I was talking about what happened to that resolution we had last year, and he goes, John, here's the audit trail. Let me show you how it works. And it opened my eyes. And then I think also the policy compendium is very powerful, because not only could you find policy, but you can analyze it and decide whether it's the policy you want, and do you need to adjust it and make some amendments to that policy.
And just to follow up on that policy compendium, the next slide talks just very briefly about that. It is a searchable index of all TMA policy. Short-term actions may not be included, such as if we pass a resolution that says we should write a letter to an agency or lobby on a particular bill. That may not be in the policy compendium, so we don't say that we're going to lobby on HB 3465 from the 82nd legislature or something that was 10 years ago. But everything else is, and long-term policies are maintained for 10 years and then subject to sunset review. All right, let's move on then. Gaining support for your resolution. We talked a little bit about this, but you really should bounce your idea and your resolution in draft form off of your colleagues in your county medical society. I always encourage people who are getting involved in TMA and in the House to have a mentor. It's such a great way to kind of get involved early, as well as if you really ask people who are your senior, who've done this before, anybody that's your senior, even if you've done it for a couple of years, if you find someone who's done it for 10 or 15, you'd be just surprised at how much mentoring they can do to you, even in a short time. You learn so much, and that expertise we don't want to have lost. The institutional memories are very valuable. So I encourage that completely, even if you don't want to formally call it mentor, just looking to the senior members of your caucus, your delegation, your county, and running it past them, you'd be surprised how helpful that is. Certainly the sections and the TMA council committees, I've always been impressed at how our council and committee chairmen and women are really some of the top people in the state in their individual areas. And their expertise is just really unparalleled. We're so fortunate in TMA to have, I guess, a big state with all the expertise that we do have. But to be appointed as chair of a council or committee, as well as just to serve on them, those are really experts in those particular areas. And then if you have a particular interest, one came up the other day where there's obviously one specialty that the policy is going to affect, thinking about your specialty society to see what would they say. those are important issues as well. So you need to gain support for your resolution. Remember, this is politics. An army of one doesn't win nearly as often as an army of many, and you're just trying to show big, broad support and that get lots of input so that you have a lot of buy-in. John?
I think mentoring is so important. It's important to know how our house works and also what past actions have been successful. I like that you brought up the councils and committees, the folks that chair those councils and committees. They've been put in that position because they've excelled at looking at policy, or they have great ideas, they can get things done. And they're also usually people you're easy to talk to. If you're not sure about an issue, talk to your mentor, call the TMA, talk to one of the staffers, see what kind of, which committee, whatever subject you want information about is discussed. And, talk to that chairperson, send them an email or call them and find out what's going on. So your resolution doesn't repeat what's been happening already. And then you can also gain their support.
Very good. So if we're talking about then a resolution, what's the standard path that a resolution takes? And this flow chart works from bottom to top, where you take a resolution or an action report, as we talked about, and that is introduced by the deadline, which is coming up here in a few months. I think Marty can probably help us with the exact date of it. I'm not recalling it all of a sudden for 2023. But is introduced by that deadline to the speaker, the speaker's office, and the House staff. And then that is assigned one of four reference committees. Committee on Financial and Organizational Affairs, there it is. Resolution deadline is February 24th. Just make note of that. That's quite soon. A little more than 2 months, but that'll come up quick. One of the four reference committees anyway, I mentioned them right there: Committee on Science and Public Health, on medical education and healthcare quality, and on socioeconomics, and FAO&A as well on there. Those reference committees will review online testimony. So purely online, you'll be able to give a written statement on your resolution. You can be able to submit references and any documentation that you care to give the reference committee. That is done all online. But that is the best time for you to make your written case. And that should be where the bulk of your evidence and your strongest argument, all the supporting materials, are submitted to the committee. The reference committee reviews that online testimony, and then they take an initial interim report of what they think should happen with your resolution. And then that interim report is a hearing is held on that. And those are live, where you are allowed to speak then, seeing what the reference committee is considering. Make your case verbally. Usually you have 2 minutes. We don't let you speak time and time again, but and other people can speak on your resolution as well. And then the reference committee takes all that was heard in the hearing, along with the submitted written testimony that was online, and tries to come up with the very best recommendation for what should happen with your idea, with your resolution, and introduces that then as a final report to the House of Delegates. That final report is considered then by the House during TextMed, and we either take the reference committee's version, occasionally we revert back to the original unamended version before the House, and if it passes, then the speakers refer the resolution to the proper components of TMA, as we saw on an earlier slide, and the audit trail both happens within TMA and then maybe be forwarded to the AMA. Of course, if it doesn't pass, then that's where it usually dies, but it doesn't have to just pass or fail. There's several different ways that things can happen out of the House. Let's talk a little bit about the reference committees themselves. So if you're giving testimony within the reference committees, of course, you should be one of the first to speak. You want to get your version out first, why you did this, and it's most appropriate for the author to speak early in the process. Of course, you should be prepared for opposition and think this through a little bit. What are people saying who don't like this resolution? How can I, this is old-fashioned debate. You need to give both your points forward and then be prepared to refute those that are against you. While compromise is sometimes a bad word in our society, I think it always does help to say, well, I'm asking for this, but I'd be happy if we got at least this, or how to drop down to a plan B if it doesn't go completely your way. Or even if you're asked by the reference committee, what would you think about this? Try and think through some of those possibilities about, I may not get everything I asked for, but this is what I think is most important to get what I asked for. Anything that you say or refer to, you should be prepared to give in a written form to the reference committee if you want them to see it. And even that day, if you have further evidence that you want to hand out to the reference committee, you can do that. And then you should also listen to the debate, because this is a little bit of a preview of what's going to happen on the House floor. So if it is up for debate, you should know. And then last, be respectful and don't take criticism personally. And we have codes of conduct which are still working their way through the TMA, but we always expect people to be respectful and to be mindful and show your colleagues the type of respect that you would demand yourself. John?
Brad, I thank you for going all through how a resolution becomes policy. I think the part that I would say you can't overemphasize is our online testimony. A lot of houses don't do it the way we do it. We take that online testimony, and it weighs just as much as the live testimony. So always testify online. Make your argument succinct and make it very clear. Don't try to write a novel. You're going to write point by point. If you want somebody else to testify for you online, have them do it. Somebody from your caucus or somebody else from a different section that also agrees, and have them testify on another point and give them another reason why your resolution is so strong. And you can also kind of short circuit some of these criticisms and concerns that other members may have if they testify. And so if they see your comment, they might point out an aspect of your testimony that maybe not pertain for their section or their type of practice. So when we do get to the live meetings at wherever we have TextMed, the process goes a lot faster. If the RefCom committee knows from the online testimony how they should handle that, and they get a better idea what your resolution means, they can give the report that is very favorable, or maybe shoot the resolution down, but at the same time, now you can respond live.
All right. Then, as we talked about, not passing or failing is not the only possibility out of the House. We can adopt a resolution. That's fairly straightforward. Not adopt, voting it down. But then it can also be referred, and that is a very common pathway for resolutions. It can be referred for study, where it's the merits and the individual aspects of the resolution, implications are debated usually within a committee and then reported back to the House. And some people get confused that if you say report for or refer for study, then you say report back, but that's automatic. If it is referred for study, there will automatically be a report back to the House. Or you can refer it for a decision if you need a particular body, and generally that's the Board of Trustees or the Board of Counselors are the only two that really have the ability to make a decision. But it can be referred for decision, or it can just be then amended and then adopted. I won't belabor those points too much in our AIP. John, do you have anything on that?
Yeah, I think referral is so powerful. Basically, your argument was strong, but there were still members in the House that felt like, well, I need more information. So that's when we ask for a study. It's referred. One of the components of the TMA will look at it and then report back. And remember, that report back is automatic. Now, you can specify when you want that report back. If you want it back the next year, you can say that, because it might be that it might take 2 years, usually not. But if you want to be for sure, because you have decisions that need to be made, things that are happening, you can specify. Now, refer for decision is really not the same thing. Basically, you're telling the Board of Trustees that we trust you. We want you to make the decision for us, whether you shoot this resolution down, whether you move it forward, whether you ask for more information, whether you take testimony from the RefCom report or from other members to make your decision. You're leaving it up to the Board of Trustees. And that's why they're called trustees, because we trust them to make the right decision for us.
Very good. So now if your resolution passes, then what happens? By and large, adopted items are assigned to a TMA board, counselor, committee, a BCC, as we say. without many exceptions, if it is a relevant policy change or something that is significant other than just a congratulations or so, it will be sent to one of the BCCs that is relevant. Other things that can happen with the past resolution is forwarded to the AMA for federal lobbying. It can affect lobbying on a particular piece of legislation so that our COL and our advocacy staff are then alerted to it. It can develop an education platform or a program, either with CME or online or handouts, some sort of educational aspect. It can form a task force. We'll talk about that here in a second. Further study by the relevant TMA components for additional recommendations, and then working with regulatory agencies, say the Texas Department of Insurance or Texas Medicaid, and then implement community initiatives if it is something on a more local level or affects a particular community. I may just go on, John, and have you comment about subjects within TMA's scope of work. Do you want to talk to those, John?
No, go ahead.
Well, let's take 3 examples. So Resolution 310 in 2019 was restricting the sale of electronic cigarettes to minors. And that became our policy. That was passed, adopted by the House. So TMA now has a policy that we should restrict the sale of electronic cigarettes such that minors should not be able to purchase electronic cigarettes. So that's one way you can affect, resolution affects TMA policy. Another Resolution 403 from 2019 was on prior authorization approval. And of course, that morphed into really legislation that our policy started work with both Representative Greg Bonin and Senator Don Buckingham at the time to form the gold card mentality within Texas. So while that became TMA policy, it also gave us the spark to start happenings within the House of the State House. And then Resolution 109 in 2022 talked about open TMA meetings. That was an internal type of policy change, amended our TMA bylaws. And if that is approved in 2023, we will have a different policy in terms of our open TMA meetings. But those are some of the examples of how a single resolution can either become policy, it can become policy that then affects the legislative and lobbying type of things, or it can amend our bylaws and our process. John?
I think Resolution 403 was so powerful. Not only gold carding in Texas, but really the nation. We're seeing movement at the federal level. Hopefully we'll continue to see movement because, Texas law can control certain insurance policies, but not all of them. And I think that's important to realize. If you really want to make change, you got to go federal. And that's what's happened with that resolution.
We've talked about the audit trail. The next 2 slides just remind you once again, the audit trail it tracks all the documents that were adopted or referred by the House and to which components those were assigned. And then also talks about if there is a report back to the House of Delegates, as there is with each adopted item, the status of each of those being reported back. And if you want to go to the next slide, that is a little bit more about the audit trail. You can see an example there. And there's an audit trail item there on a reference committee on FO&A and some policy compendium changes. I won't belabor that point, but audit trail. And if you ever have troubles navigating that or understanding it, then our House staff, Marty, is able to help with that. Brad Burnett is also in the House staff, and so both of them are available for that. Talk a minute about motion to refer. When we adopted AIP, the motion to refer, you can refer for study, as we talked about, and we've already mentioned some words on that. But I will say that, not to confuse people, but refer for study is a motion that is actually outranked then by a motion for action or decision. So if there's a motion for to refer for study on the floor, and someone rises and says, I move to refer this for action or decision, then that takes precedence. It actually is a higher order motion. And so then we would consider the motion for action or decision. And if it is passed or adopted, the motion for action decision, and that item is dispensed with. If that fails, then we refer back to the motion for study. But just to point out that this is a higher order action item, And so a motion to refer for action or decision outranks a motion to refer for study. John, do you have anything on that?
Yeah, I love the ranking system, but I think it's a little confusing for some of our members. As a speaker, it's our pleasure and our duty to explain to the House of Delegate members how parliamentary procedure works. And if you ever are confused, ask us. And we're in a meeting, stand up and raise your hand and give a point of order and ask us, what the heck's going on? Why did that happen? That this ranking thing basically is kind of like when you're dating a girl or whoever, and you start texting them, and that's the first action. And then you decide, well, I'm going to actually go talk to her. Maybe that's not the same thing, but that's the next level. That kind of precludes texting. Now you're actually talking to them. And then you're going to go out on a date with them. Now you might text them, but maybe not. Maybe you're going out on a date, and then you decide, you know what, I'm going to marry this person. And that's the little higher ranker. Now you're not going to go backward. You might go backwards, but you're not going to start all over again. You're way up here. And that's how our ranking system works. You've got an action that comes before the House, then it's amended, or it's referred for study, or it's referred for decision. And that's how we run the House well. And our job is to run the House, not have any secret ways we do things. I saw some comments recently, and things happen this way, and I'm not sure what's going on, but there's a reason for them. And these rankings are posted in our handbook. So if you're not sure how that works, let us explain it to you.
That's great. That makes so much sense. I wish I'd have taken a dating one-on-one before. I'd probably done a lot better if I'd understood that too. But
you're still texting, are you?
That's how it works. It makes a lot of sense. All right, referral. Let's talk about referral for a second. Then, it's not always bad, and people think that if something's referred, that they somehow think that's not winning the gold medal, that is to be avoided. But really, referral is not always a bad thing. In this example, Resolution 304, which was called Extreme Risk Protection and Orders, or Risk Protection Order and Gun Violence, Ryan Van Ramhorst, many of you may know his name. He actually put in a resolution that the Texas Medical Association advocate for legislation permitting extreme risk protection orders in Texas. It was referred. Didn't pass is probably would have been his first choice, but it was referred to the Council on Legislation and the Council on Science and Public Health. And sometimes we do refer them to two different entities if it kind of covers two different councils. And as a result of that resolution, actually a work group was formed by our then TMA President, Doug Curran. And really a very large portion of TMA went to work on this issue by way of referral to form the TMA Firearms Work Group. And that work group had a very comprehensive and I think well-respected, really no matter what political persuasion you are. It was a magnanimous and large policy change for TMA that I think was well accepted. And that was all started by the way of a resolution that was not passed, but ended up moving TMA and setting the forces that develop policy in motion in a way that was very, very significant. So don't always think that referral is a bad thing. John, you have anything on that?
No, this is a wonderful example of how the referral process works and how you can get really significant results.
Well, we're rounding the corner here, almost done. A few more slides. I will say, of course, there is always that possibility a resolution is not adopted if it dies. Well, if that happens, certainly figure out what the problem was. Talk with those, especially if it does fail by way of the reference committee being against it or heavy testimony against it. Talk with the people who testified against it or the reference committee who recommended it not pass, and try and learn something from that. Ask what could have changed. It may be a disagreement and you can't come to terms, but there may be ways to subtly refine and resubmit an idea. Try and get. And that's usually obviously the best method for success. You have anything on that, John?
I would say, if your resolution didn't pass, make sure you weren't trying to ask for too much at once. And maybe sometimes or partition certain parts of it. So if you can support for one part, maybe you can move forward the next year. Well,
then the final tips on the resolution writing process. Certainly do your research. You need to be an expert if you're going to introduce a resolution on a topic, don't be out experted and know your stuff. Know your opposition and discuss exactly why they're in opposition. Most people will be happy to tell you. And frankly, doing that ahead of time sometimes puts out some fires. Understand basic parliamentary procedures. Speakers are obviously happy to talk with you about that, as is Marty, as a parliamentary expert as well. Ask us about that. Review your House of Delegates handbook so you know what's coming up at TextMed and in the House, and be prepared to have the resolution referred if needed. So if you do these things, your chance of success, even if it's not the first time, are much, much higher. Do you have anything on the final tips, John?
No, I think I covered some of mine already, and I just want it's a pleasure to do this with you tonight.
Well, I hope it's been helpful for folks. If we talk about, the House is not any one person, it's not any group of people. It really is the entire TMA represented in one room. And if we talk about the people behind the process, you just have no idea how many people are at work to make a TextMed and a House of Delegates successful. It is mind-boggling to me. And when we had to go to those virtual years just to see they're not often always in one particular spot, but in those years they were all in one particular spot. And I mean, it looked like a NASA control room. I've never seen such both technology as well as a mass of people working hard to make the House work. Even though we're back in person, that continues. It's just an incredible amount of work and effort, and it's not just staff, but also the delegates and the alternates. Frankly, even some of the family members, the spectators. Our houses are open. We have spectator seating, and then all those who've come to either see those honored or be a part of the process who are related to those meetings. It is just a very big. It's coming together. The House of Medicine, Texas, all under one roof, and it's always an exciting time. I'm looking forward to it once again. And building relationships are really what it's all about. You don't get those relationships unless you attend meetings, attend conferences and events. That's really where connections are made. It's the conversations there and some of the enrichment that happens at TextMed. So take advantage of that, both occasionally in the expo booths and halls about our keynote speakers and the smaller meetings that happen, even some of the accessory meetings and ancillary meetings, specialty meetings that happen at the same time. But make connections, meet people. And that's why we wear badges and we put our first name large on the badge. We expect people to make connections and stay connected. Get your email, get your social media, hand out your cards. This is the time to network in the good sense amongst your fellow colleagues, which we do so much with non-physicians. And so many people are trying to get in between it, but it's still physician to physician communication that is so very, very important. John, do you have anything on that?
I love TextMed. I think it's an extrovert's paradise, to find out about people and what they do and who they are. And then you find out you're going to be working with them over different issues and you can really get to know who they are and work well together.
I think we have one more slide on the people behind the process, but if we had to summarize the whole evening for the House of Delegates and being a representative as you are for your area of Texas within the House, be familiar with all these online resources that we've talked about. Ask for help. I think Marty can probably put the email address for the House. Any question that you have within the House, you can email us. And that's speaking directly. That's checked daily. During House meetings, it's checked, I think, hourly. We're on top of that. But that email address is something that we monitor. HOD@textmed.org, as she just put there. Remember that titles and resolves are the key portions of a resolution. Build your broad support, and then build those relationships through the process so that when you stand up and say you're in favor of something, you have a coalition behind you. John, you have any other closing words on that?
No, I just want to encourage people to write a resolution, just get started and get it done. That's the first step, coming up with your idea and then working through the process that we just went over.
Very good. Well, we're a little longer than we had in mind, but we do have time for a few questions. I think Marty Francisco is going to help us. If there are questions, she will look at those, I guess, in the chat. Is that right, Marty? And then you'll give them to us.
Yeah, so we had a couple of questions pop up during your presentation. I went ahead and did kind of answer them because I had some links that I wanted to share with people, but we can go ahead and answer them again live. So the first question was, are there resources to see examples of resolutions that have passed and others that have failed?
Well, certainly the audit trail shows the disposition of those that have passed and have failed. Frankly, if you just need some good examples or some bad examples, we can give those individually too. But everything is under the audit trail, so you can always go there and see. There'll be plenty that both passed and were adopted, and those plenty that were not adopted, and plenty that were referred. So you may just want to take the most recent year if you want to look at 2022. We had some atypical years in there because of COVID and had some holdovers for resolutions. We considered it quite a bit in 2022, but so there was a little bit of atypia in there, but by and large, just going to any recent year, you'll certainly find examples of those that were adopted, not adopted, and referred. John, do you have anything on that?
Nothing to add. Thank you.
Anything else, Marty?
Yes, the other question was, can a committee or council chair sit on a TextMed reference committee?
We try and spread the mustard a little bit, frankly, a lot of times the chair of the council committee is one of the persons that's giving testimony, and that's quite helpful. But by and large, we don't appoint the chair of a council committee to a reference committee. We try and make that unique. I won't say that's an absolute, but that's the way it usually works. Am I correct on that, Marty?
Yes, I did respond that they often are. I mean, they'll apply to sit on a reference committee, but they won't be assigned to the reference committee to which they have submitted reports to the House. For example, the chair of the Council on Science and Public Health would not sit on the reference committee of said name.
Right. And frankly, sometimes I think it's helpful if the chair of the Council on Science and Public Health is in the reference committee on that subject area testifying. It's powerful, but we don't want to be too inbred or too many hats at one time. So that's not something that is done. Any other questions anybody know about?
I'm not seeing any.
Well, we've had good participation. This presentation will be is being taped or videoed and recorded. I guess is a more modern way to say it, not taped, but it will be available to view if you want to point it out to someone who's not able to be here tonight or want to go back and reference anything on these slides. Importantly, you do get CMA credit for this, and if you scan that QR code there, it will take you to the way to register such that you get credit. Marty, do you want to explain any part of that?
It's pretty straightforward, and that's how we've started to do all our CME reporting from now on. So if you do have a question about this, just email myself or the Knowledge Center, and we can hook you up with this logo again if you missed it tonight.
Well, I again thank Marty and Karen and other folks who there's their contact information. And Karen's the director of the TMA sections and programs. Marty is the manager of HOD governance. There's their contact information. They are extremely helpful, extremely knowledgeable. They know this stuff like the back of their hand, and I've always found them to be very helpful, approachable. If you have questions, don't hesitate to reach out. They are a great resource. I do hope everyone who's listening has found this helpful, and it's been my pleasure to be with you. I greatly look forward to TextMed 2023. We have a vivacious house that is active, it is lively, it is really the lifeblood and pulse of TMA embodied in one meeting. And I look forward to seeing all delegates and alternates and anyone who's attending TextMed as we come up here ready for 2023. So I enjoyed the time and look forward to seeing you. Be happy to answer any questions myself. You can get my contact through Marty or Karen, and happy to answer any questions or talk with anybody. John, you want to say a few words?
No, I echo your sentiments on our staff. They're wonderful, and just hope everyone has a happy holiday, and I look forward to seeing you next year.
Very good. Marty, anything else we need to do?
No, that's all, Dr. Holland. Thank you very much.
Well, with that, it's 8 o'clock. I think we timed it pretty well. Hope everyone does have a safe holiday, and we will see you in the new year. Take care.